Hey guys, welcome back to the channel. This is Side Dental Vlogs. So recently I did a RCT on a patient who was having a AICD device implanted in his body. So what is an AICD device? As we all see in movies that whenever a person is affected with heart attack, so doctors come with two diodes and they push on the chest, and with a bump the chest arises and the patient comes back to life. In a similar way, an automatic device is implanted in the body of the patient with cardiac diseases. So, what happens is whenever the patient gets or is about to get a heart attack or some kind of ventricular tachycardia, so that automatic machine is there inside in their body that is costing around 20 lakhs. So, that will cause the heart to flow in a normal rhythm and it will prevent heart attacks. So that kind of patient if comes to our clinic for a dental RCT or extraction, so we tend to get scared ki how will we perform the procedure, do we need to have a cardiologist advice, what blood test we should write. So when the patient came to my clinic, so he was a retired IT officer and he told me that he is having this problem, and 7 8 years back he was completely normal and he had suffered a heart attack in between. So when I checked the BP, it was absolutely normal and he was taking many medicines like Clopid and aspirin 150 micrograms. So you all know that this Clopid is a blood thinner and this aspirin is an antiplatelet agent. I have made many videos on cardiovascular, how to control the patients, how to control the bleeding, how to manage a patient. So this case particularly, I want to give you an example. So initially, I also got scared कि अरे इसका कैसे करूँगा. Then what I did is first of all, I wrote a blood test, activated plasma thromboplastin time (APTT INR), which came out to be little bit higher than the normal. The prothrombin time was little bit higher. It was around 30 seconds. So, according to the American Heart Association recent guidelines, you can remove a tooth or do a RCT without stopping all the medicines like Clopid and aspirin. Because the cardiac safety is more important than the dental safety. Means if there is a dental bleeding in a cardiac patient who is in blood thinners, it doesn't mean that you won't be able to control the bleeding. You can control the bleeding with gel foams and ice packs, but stopping the cardiac medicines may cause adverse effect on the heart. So I told the patient, don't stop any kind of medicines. When the patient went to the cardiologist simply said 5 दिन के लिए बंद कर दो medicine. आजकल पता नहीं cardiologist ऐसा क्यों बोलते हैं, but this is not the fact. I talked to the cardiologist, which the procedure will be totally normal. So there was one RCT and one extraction for the patient which was about to be done. So the first precaution what I did is I have all emergency drugs in my clinic. So whatever, if any emergency situation comes, you should have the numbers of ambulance also. So when the patient came, I administered the local anesthesia and I was in contact with the emergency doctor as well. So I am administered local anesthesia at a very slow pace, like I was giving 1 ml in 1 minute, so 2 ml in 2 at a very slow pace, and then I waited for 15 minutes. Before starting of the procedure, I told the patient to have dinner and come, so we have ample amount of time. So when I started the procedure, patient was completely relaxed, no other patient appointment in the clinic, and I told the patient will perform the procedure after half an hour. So immediately after, what we tend to do is हमको घर जल्दी जाना होता है, so we give the LA and immediately we start doing the extraction. So I gave the LA to the patient. I was talking to the patient regarding income tax and all those things to divert his mind. And after a period of 20 minutes, I saw it is completely anesthetized, and I did a root canal on the tooth. I put a post and core, and I did extraction also. And the complete episode was uneventful. So 3 things we have to remember: have confidence on your talent or whatever you have studied, and take proper precaution, like you have to take the emergency numbers or ambulance numbers, so that in case of emergency, so if you treat these kind of patients, you will have a lot of confidence. What we usually do is we give medicines and tell the patient अब 3 दिन बाद आइए डॉक्टर से पूछ के आइए. अब कार्डियोलॉजिस्ट बोल देता है कि नहीं बंद करना पड़ेगा मेडिसिन. So that is even more harmful, more dangerous. So as a patient जब आए, then you should contact a cardiologist. You should have the numbers and you can discuss this matter. You can read articles and have some confidence. Knowledge is power, what I believe. So I performed the procedure on the patient. Patient was extremely happy. He is not knowing the gravity of the situation. अगर आप पेशेंट को ज़्यादा ग्रेविटी ये सब समझाने जाओगे, पेशेंट वोंट गेट ट्रीटेड फ्रॉम यू, राइट? सो आई डिडंट टेल दैट मच, आई टोल्ड यू जस्ट हैव टू गो अ ब्लड टेस्ट। और उसको मैंने ऐसा नहीं समझाया कि बहुत रिस्की है, ब्लड आ सकता है, तो पेशेंट नहीं कराएगा आपके पास और आप डर जाएगा, पेशेंट कभी भी नहीं कराएगा, पेन में मेडिसिन खाता रहेगा। So this is the situation, you have to assure the patient that nothing will happen, and you have to perform the procedures in complete safe environment, clean environment, and calm and peaceful environment. So that's all for today's video. Thank you.